Colon cancer is the third most common cancer and the second leading cause of cancer-related deaths worldwide. Every single year, colon cancer silently claims over 935,000 lives globally. That's nearly one person every 34 seconds. But what if I told you that many of these lives could have been saved, if only the warning signs were recognized earlier? Some symptoms might seem minor, a little fatigue, a small change in bathroom habits, but others are far more sinister. In today's video, we're revealing the 10 most critical warning signs of colon cancer, including the single most dangerous symptom that too many people ignore, until the disease has already spread. Don't become a statistic. Your life, your health, your future could depend on the information you're about to hear. Make sure you watch all the way until the end, because missing even one sign could make the difference between early detection and a devastating diagnosis. And before we dive in, if you believe that your health, and the health of those you love, is worth protecting, please subscribe to True Health right now. Every subscription helps us reach more people with life-saving health information, cancer awareness, and preventive health tips. Now let's dive straight into number 1. 1. Persistent change in bowel habits. One of the earliest and most overlooked warning signs of colon cancer, and even bowel cancer, is a persistent change in your bowel habits. This includes chronic diarrhea, ongoing constipation, or a noticeable shift in the consistency, color, or shape of your stool. If you're suddenly making more frequent trips to the bathroom, straining, or experiencing irregular bowel movements that persist for several days, don't brush it off as just a sign of aging. Many older adults tend to attribute these changes to diet, stress, or getting older. But recent cancer research urges otherwise. Persistent changes in bowel habits, especially when accompanied by other symptoms, could signal early-stage colon cancer or even early involvement of pancreatic cancer. According to recent cancer research, in some cases, these irregular patterns may be caused by a growth, such as a polyp or tumor, disrupting normal digestive function. For seniors especially, maintaining digestive wellness is crucial. Changes in your gut health can signal much more than diet issues. They can reflect serious underlying problems like colorectal cancer. Preventive health experts recommend paying close attention to any changes that last more than 2 weeks. Healthy tips for seniors include keeping a health diary, track your bowel movements, and don't hesitate to talk to your doctor if things seem off. Early detection through colonoscopy can lead to early colon cancer treatment, often before the cancer spreads. 2. Unexplained anemia, a hidden danger you can't ignore. Anemia, a condition where you have lower than normal levels of red blood cells, can quietly be one of the first signs of colon cancer or bowel cancer, especially in seniors over 50. If you're feeling fatigued, dizzy, short of breath, or even looking paler than usual, it's not just aging. It could be your body signaling an underlying problem. Here's why it matters. Colon tumors can slowly bleed into the digestive tract. Over time, even a small, persistent loss of blood leads to iron deficiency anemia, draining your body's energy reserves without you even noticing. According to the latest cancer research, many cases of colorectal cancer are first discovered because of routine blood tests revealing unexplained anemia, long before digestive symptoms ever appear. Senior health experts stress the importance of not ignoring these subtle signs, especially if you're experiencing breathlessness doing simple activities, persistent tiredness, or weakness. It's essential to speak to a healthcare provider. Remember, unexplained anemia could be your body's first and only early warning before colon cancer progresses to a more advanced, harder-to-treat stage. Don't brush off unusual fatigue as just getting older. In preventive health, early detection saves lives. It's a call from your body to take action, to stay informed, and to prioritize your health journey. Remember, with advances in colon cancer treatment and early intervention, survival rates skyrocket. Protect yourself and your loved ones by staying alert to this powerful symptom. 3. Abdominal discomfort that doesn't go away. Have you been feeling unusual abdominal pain, bloating, cramps, or a sensation of fullness that just won't go away? Persistent abdominal discomfort is one of the lesser-known but critical warning signs of colon cancer and bowel cancer. Unlike the occasional stomachache after a big meal, the kind of discomfort associated with colorectal cancer often lingers for weeks and doesn't respond well to over-the-counter treatments. New research from major cancer prevention centers highlights that early tumors in the colon can irritate the lining of the intestines, leading to cramping, gas pains, and even feelings of incomplete bowel movements. Healthy tips for seniors emphasize listening to these subtle body signals. It's not just indigestion. It could be a clue that your digestive tract needs medical attention. If you're experiencing consistent bloating, strange gas patterns, or unexplained belly pain, especially if paired with other colon cancer symptoms like blood in the stool or weight loss, you must prioritize a doctor's visit. Preventive health screenings like CT colonography or a traditional colonoscopy can reveal issues before they escalate. Senior health awareness today is about being proactive. Your abdominal health is a mirror to your deeper wellness. 4. Lump in the abdomen, a silent red flag for colon cancer. Feeling or noticing a lump or mass in your abdomen, especially on the right side, can be a critical warning sign of colon cancer or even bowel cancer. Unlike many cancers that cause sharp pain early on, colorectal cancer can silently grow into a palpable mass without causing obvious symptoms at first. Health experts explain that a lump may form when a tumor grows large enough to be felt externally. This mass is often firm and non-tender, and it might go unnoticed until it becomes significantly bigger. Tumors located on the right side of the colon are particularly sneaky. They tend to grow larger before showing symptoms, because the right side of the colon has a wider diameter, and the stool is more liquid, allowing a tumor to develop without causing early blockages or discomfort. Colorectal cancer awareness campaigns stress that if you detect any abnormal lump, even if it's not painful, it's vital to seek immediate medical evaluation. This could mean the difference between catching colon cancer early, when treatment is most effective, versus later stages when outcomes are far more serious. Bowel cancer specialists also note that abdominal lumps can sometimes mimic other conditions like hernias or cysts, making proper diagnosis absolutely crucial. Never ignore a lump. Early action is key to cancer prevention and protecting your healthy life. 5. Changes in bowel habits. Most of us don't think twice about our bathroom habits, but changes in how you go can be a major warning sign of colon cancer. If you're suddenly experiencing persistent diarrhea, constipation, or even a dramatic change in stool consistency, especially if it lasts for more than a few days, it could be a clue that something's wrong inside your colon. Recent studies published in top cancer research journals emphasize early colorectal cancer can block or narrow parts of the intestine, leading to unpredictable bowel patterns. And yes, sometimes these changes are the very first symptom that cancer is developing. When it comes to senior health and preventive health strategies, monitoring bowel movements is critical. Unusual thin pencil-shaped stools, new onset of chronic diarrhea or constipation without dietary cause? Those are red flags that should never be ignored. And here's where it gets even more serious. Sudden bowel habit changes can also indicate issues beyond the colon, including pancreatic cancer, which sometimes presses on intestines, causing similar symptoms. Whether it's colon cancer, bowel cancer, or pancreatic cancer, early action is everything. Prioritize health education and wellness tips for seniors, track your patterns, and speak up early to your doctor if something feels off. 6. Rectal bleeding or blood in the stool. Seeing blood in your stool or on toilet paper can be frightening, and it should never be brushed off as just hemorrhoids. In fact, rectal bleeding is one of the most alarming colon cancer symptoms. According to the latest cancer awareness campaigns and clinical data, rectal bleeding, whether bright red, dark maroon, or black tarry stools, is a sign of active bleeding somewhere in your gastrointestinal tract. And in adults over 50, particularly seniors, colon cancer is one of the leading causes. Colorectal cancer often starts as small bleeding polyps. Over time, these polyps can become malignant, causing internal bleeding that appears in your stool. Even if the bleeding seems minor or stops temporarily, the underlying problem could still be serious. Experts in preventive health and senior wellness tips stress this. If you notice blood even once, do not wait. Diagnostic tools like a colonoscopy, CT colonography, or a fecal immunochemical test, FIT, can literally be life-saving. And here's another important connection. Blood in stool could also rarely indicate pancreatic cancer spreading toward the intestines, although colon sources are far more common. Either way, it's about taking control of your healthy life journey through early detection. Rectal bleeding is not normal. Early action equals higher survival rates and better outcomes. 7. Persistent abdominal discomfort, cramps, gas, or pain. We all get the occasional stomachache, but persistent abdominal pain should raise immediate concern. Frequent cramping, gas, bloating, or generalized discomfort that doesn't go away could be one of the early warning signs of colon cancer. The American Cancer Society and leading cancer research institutes now emphasize that tumors growing in the colon can create pressure, inflammation, or even partial blockages. This leads to ongoing digestive issues that often feel like minor problems until they worsen. Wellness tips for seniors always highlight the importance of listening to your gut, literally. If you're experiencing unexplained pain, fullness, or bloating that lasts more than a week, especially if combined with changes in bowel habits, it's critical to seek evaluation. And remember, persistent abdominal discomfort isn't exclusive to colon cancer. It could sometimes indicate other gastrointestinal cancers, including pancreatic cancer or even bowel cancer. Preventive health starts with awareness. Don't normalize ongoing gut discomfort. Your body may be trying to tell you something important about your healthy life. 8. A feeling that your bowel doesn't empty completely. Have you ever finished using the bathroom but felt like you still had to go? That sensation, like your bowel isn't empty, even after a full movement, is another key colon cancer symptom you can't afford to ignore. Known medically as tenesmus, this uncomfortable feeling can occur when a tumor obstructs part of the rectum or colon. The body senses the blockage and misinterprets it as needing to evacuate, leading to repeated frustrating trips to the bathroom. Colorectal cancer awareness groups now stress that seniors often overlook this symptom, assuming it's just part of aging, irritable bowel syndrome, or hemorrhoids. But if you're experiencing this regularly, especially if it comes with blood in stool, abdominal pain, or bowel habit changes, it could be a warning sign of a more serious underlying issue. And here's the critical point. A sensation of incomplete evacuation can also very rarely hint at other deep-seated cancers affecting the GI tract, like advanced pancreatic cancer, where tumors press on intestines. Health education is power. Know that this symptom is not normal. Prioritize your preventive health, advocate for yourself, and work closely with your healthcare provider. 9. Unexplained fatigue. We all feel tired sometimes, but here's a critical health tip. Unexplained fatigue that doesn't improve with rest could be a serious warning sign of colon cancer. Fatigue linked to colorectal cancer isn't just being a little tired. It's deep, persistent exhaustion that affects your ability to complete daily activities, even basic ones like walking, cooking, or socializing. Why does this happen? Research from top cancer institutes shows that colon tumors can slowly cause chronic blood loss internally, even before there's visible blood in stool. This can lead to anemia, decreasing oxygen flow throughout the body and leaving you feeling drained and weak. Fatigue is also a symptom of other serious conditions, including pancreatic cancer and bowel cancer, making it a universal signal that your body needs a health evaluation. In the world of senior health and reverse aging, maintaining energy is vital. So if you're sleeping well, eating normally, but still feeling overwhelmingly tired, don't ignore it. This could be your body's quiet cry for help. And early cancer prevention starts with listening to those whispers before they become roars. 10. Unintentional weight loss. And finally, one of the most alarming warning signs: sudden unexplained weight loss. If you find yourself losing 5, 10, or more pounds without trying, without changing your diet or increasing physical activity, it's time for a serious health check. Colorectal cancer, pancreatic cancer, and other gastrointestinal cancers often cause weight loss because tumors interfere with the body's ability to absorb nutrients or may ramp up metabolism by triggering inflammatory responses. The latest cancer research now points to weight loss as one of the earliest symptoms in aggressive cancers. This is why cancer awareness campaigns stress the need to track subtle body changes, especially after the age of 50. Wellness tips for seniors always recommend regular weight monitoring, not just for heart health, but as a frontline defense against hidden illnesses. If you're shedding pounds without explanation, especially combined with other symptoms like fatigue, abdominal discomfort, or changes in bowel habits, it's crucial to seek a comprehensive evaluation, including colon cancer screening if appropriate. Your healthy life depends on proactive preventive health decisions, and recognizing unintentional weight loss could save your life. Today, we uncovered the 10 warning signs of colon cancer that you simply cannot afford to ignore. From subtle changes in bowel habits to unexplained fatigue and sudden weight loss, every symptom is your body's way of sending you an urgent message. Health education is the first step toward powerful life-saving action. Staying informed isn't just about preventing colon cancer. It's about embracing a healthy life, protecting your loved ones, and supporting overall senior health, reverse aging, and wellness. At True Health, we're committed to bringing you the latest updates in cancer research, preventive health, and wellness tips for seniors, because health information should be empowering, not overwhelming. If you found this video helpful, please don't forget to like it, subscribe to True Health, and hit the notification bell so you never miss out on more essential content about cancer prevention, senior wellness tips, colon cancer awareness, and so much more. Your subscription helps us reach more people who truly need this life-saving information. Together, we can build a stronger, healthier community and change lives. Thank you for watching. Stay proactive, stay empowered, and remember, your health is your greatest wealth.